To talk more about child life and the importance of child life is Jennifer Seiler. She is a certified child life specialist and joins us now to talk more about Pediatrics Unit 39. Jennifer, thank you so much for being with us.
Thank you. Welcome. Or hi.
Hi. So I was just talking a little bit about child life, but you're the expert. So just kind of give us an overview. I think there's still a lot of people, as much as we've thrown that term around over the past many, many years, who aren't completely sure what it is.
Yeah, so we help patients and their families cope with the uncertainties and stress of being in a hospital setting. And we do that in various different ways. So we make sure that patients understand why they're there. So we'll have a conversation to make sure they are aware of why they're here. And then also to help explain what to expect while they're in the hospital setting. Not knowing what to expect and the uncertainties of what's going to happen to them and their body can be very anxiety provoking. And we really make sure to educate both the patient and the family what is to come. My big phrase that I like to use is there's no surprises here in the hospital, and we're going to make sure you're prepared for what's about to happen.
Except that if there are any surprises, it's usually happening in the emergency department, because that's where nobody kind of knows what's happening yet. So how do you do that in the emergency department? And I know you're still very active there too.
Yeah, so there are a lot of surprises that might come about, but we really, in the pediatric emergency department, understand that kids deal and cope with stress much differently than adults. So we try very, very hard to prepare them for experiences before they happen. So may it be a conversation, or maybe a child life specialist will come in the room and use real medical equipment to take them through a step of a procedure, and then develop some kind of coping strategy. Maybe it's watching a movie on the iPad, maybe it's squeezing a stress ball or staying connected with their parent. We try to give control back, as I heard you say, that there is tons of control that's taken away from both the patient and the family when you're in a hospitalized setting. So we really try to help ensure that the patient's voice and the parent's voice is heard and allow them to be a part of a procedure at hand or anything that might be happening.
Average, if I bring my child to the emergency department, the pediatric emergency department, how quickly do you try and connect with that young patient?
Are you speaking for child life?
Yes, for child life. They've already been seen by the nurses or maybe even seen by a doctor, but how quickly can child life get in there and just figure out what the situation is?
Sure. So we have 12-hour coverage in the emergency room. So we are one child life specialist for our combined care unit that includes our ER side and our inpatient side. There's various different factors that go into where we make the assessment of where our needs, where we're going to support needs for. So may it be the reason the patient's there, if they have parents with them or not have parents with them, the type of procedure. Children are very often asking, am I going to get a needle? So if we know if their visit's going to include getting a needle, we are going to make sure to make them high on our list to see. But as parents, you can always ask for a child life specialist if you think your family or your child would benefit from a little extra individualized, child support. We wear pink, so we're very easy to be seen on the unit, but we try our hardest to meet every patient that comes through our doors.
Must be very good at assessing situations pretty quickly.
Yes, we have training in various different medical procedures. We kind of know what, reasons patients come in, how their treatment, what it might look like. So we might know, hey, we have, someone coming in, we know probably in a half an hour they're going to get an IV, for example. So we kind of use that to kind of tailor who we see first.
I feel like child life specialists have a particular personality and warmth that they exude just to be able to do their job so well. How has that been difficult when you have to mask up and wear however many layers you have to wear to still connect with the patient?
Yeah, when COVID hit, it was an adjustment for everyone in the healthcare field. And the main way that we on the medical team support, connect, is now covered up. So patients and the medical team is looking far different than families and patients are familiar with. So to help with that transition and to help with that connection, I know myself and a bunch of the pediatric nurses and doctors, the first thing we do, and I see that there's a picture of me on the screen, we created these face stickers. So the very first thing we do, knowing that, our faces are covered up, is, hi, my name's Jenny, I'm a child life specialist, and I take a pause and say, this is me underneath the mask. And so I try to help to build that quick rapport and build that trust. And nurses and doctors, they all do the same thing. We also, as you can see, and I brought my shield, we have stickers to make it more pediatric friendly and less foreign and scary. Something for kids to see, to talk about. I have Toy Story on mine, and so often kids are like, oh, I see Buzz. And that helps to generate that discussion and create a safe environment and supportive environment for both the patient and the family. So those are kind of the major changes.
That's brilliant. So you mentioned that we can, at any point as a parent, we could ask for a child life specialist. Do you recommend to parents, if they're with their child, particularly if that parent is feeling anxious themselves and the child is picking up on that, are there certain things that a parent should look out for that they think to themselves, I don't think I can do this myself, or I can't put my child in the best position to receive this treatment. I need to get a child life specialist to help me. What should we look for in ourselves or in our children to get you to help with the situation?
Yeah, that's a great question. So kids are often looking to their parents with how to react to a situation. So oftentimes we are going in, yes, to support the patient, but more often than not, we're also there to help support the parent. No one wants to come to emergency room, especially during COVID times. It's a very anxiety-provoking experience. So we are there to help parents to ask questions, to maybe ask some clarifying questions of things that maybe they didn't understand, or just because they're so anxious and stressed out about their child that maybe they just kind of missed. So we are not only there to explain everything to the patient, but also allow the parent to ask those questions, feel prepared, and then also bring them in. A parent's main job is to support their child, and that's often stripped in a hospitalized setting. So we have little tips and techniques that we can incorporate parents within the care. So maybe it's holding for a procedure. Maybe it's having a parent sing their favorite song. And then also talk about, if you are calm, your child most likely is going to match that. So really helping parents to alleviate their anxieties as well. But it's okay to ask for a child life specialist, or just to kind of ask clarifying questions in the moment, maybe if one of a child life specialist is not available.
Is there an extra cost to utilizing Child Life?
We are free. Our services we do not charge for. We are a grant-funded program here at GBMC, so you will never get a bill for a child life specialist service.
Which leads me to ask, other than grants, do you receive support from the community in any other ways? And if so, how can we support you?
Yeah, so we've had some very generous donors in the past, especially with COVID. We are not able, one way that we create a healing and supportive and safe environment is to bring in normalizing play activities such as, dolls, Legos, Barbies, craft material. And that's one way we can quickly just make the hospital a safe environment. And because of COVID, we have kind of shifted with the amount of materials we're allowed to provide. So we're giving a lot more of single use things that families and patients can bring home. So we've had lots of donors reach out and providing a bunch of craft supplies for us. Donating stuffed animals, donating stress balls. We use that a lot in our work. So you can donate board games, card games, those kind of things. Normalizing activities, thinking about, if your child was hospitalized, what would comfort them? And those are the items that we will gladly accept as long as they're new.
All right, and all of that can be found on the website at gbmc.org/give or /donation. Either way you can go. Finally, before I let you go, I just wanted to ask your advice for a parent who may be facing taking their child to the emergency department? What are some things we can do to make the experience go as smoothly as possible?
Yeah, oh, another great question. And as I said before, many people aren't planning to come to an emergency room. It's an emergent reason why you come. So the one thing I would say for a parent is if your child has some kind of comfort item, to see if you can grab that comfort item. May it be a tablet or a blanket or a stuffed animal. That is something that can really help to comfort your child. And also as a parent, you are your child's advocate. So don't be afraid to ask questions. Don't be afraid to share things that really work for your child, or maybe things that don't work for your child. You are the expert on your child, and we are a multidisciplinary team that's here to support you and your child. So please don't be afraid to speak up and let us know what works, well for your child.
All right. Is there anything else you would like to add to those of us who may be facing this situation? Because I feel like you've seen so many kids in so many different positions that we can help you or we can help ourselves.
Yeah, I think the main thing is when I'm seeing kids, that the hospital is a safe place to be, and it's a place where when you are sick, you need to be. And so we are here, the entire staff is here to support you and your child, and to wear your mask.
All right. Thank you so much for being with us, and thank you for all you do for our families who may have to come to GBMC. It just makes a world of difference. Thank you for being there, especially during the pandemic. And we also want to let you know that if you're interested in knowing the very latest about what's happening at GBMC with regards to COVID-19, Dr. Chazar has been so open and transparent about what they've been doing, how the procedures have been going, what the numbers say, what the latest statistics are. And he will be having another community update tomorrow. It will be posted on Facebook. So if you get on GBMC's Facebook page, you can find out that information. And it's just keeping us all informed because obviously we're all in this together. So thank you so much for being with us today for Greater Living as we talk about the emergency department. Hopefully you won't have need of it, but it's nice to have this information. If you do, it seems a little less scary if you kind of know what's happening there, even if you can't see it for yourself. So, and we will join you next month. And until then, stay well, and we'll see you soon on Greater Living. Have a great day.